thought the wire was de-energized. Fire when it hit the ground. Listen to that, you can hear it. Officers credit the worker's safety equipment for helping him to avoid injury. Glad he did. The nation's measles crisis is getting worse, now accelerating to the second highest level in a quarter century. The CDC has confirmed 555 cases across 20 states, including New York, where an emergency vaccination order is mandated for parts of Brooklyn now. The Washington Post is reporting health officials tracked down what they call patient zero, a man who had traveled from New York to Michigan and inadvertently infected 39 people. Brian Yanis, let's get the news on this from you.
Harris, no state has been hit harder with the measles outbreak than New York. And New York City's health commissioner says they expect the number of measles cases to continue to rise for at least the next 3 to 5 weeks. Now, since October, there are now 329 measles cases in New York City, primarily in Williamsburg, Brooklyn. That number is 44 more than last week. In Rockland County, just north of the city, the number of cases has risen to 186. Now, in order to stop the spread, last week, the city issued a rare order making vaccinations mandatory in the 4 hardest hit zip codes in Williamsburg, Brooklyn. Yesterday, 5 parents filed a lawsuit anonymously claiming the order infringes on their religious rights and that, quote, the emergency orders grossly understate the risk of harm to children, adults, and the general public from the MMR vaccine, while at the same time overstating the benefits. Yesterday, New York City's Deputy Mayor of Health Services said vaccines are safe and blamed misinformation from the so-called anti-vaccination movement for this outbreak.
This anti-vax movement has proven to be very dangerous. These outbreaks should not be happening. We should not have active measles in the United States, period, full stop.
The outbreak is primarily in Jewish Orthodox communities. It started when an unvaccinated child got the measles on a visit to Israel and brought it back to New York. Fox News can confirm that Michigan's first measles case came from a man who, unbeknownst to him, got the measles while spending months in the Orthodox community in Brooklyn, and then he traveled to Detroit, Michigan, and unknowingly infected 39 others there. Harris, 90% of unvaccinated people around an infected person will get the measles. It is highly contagious.
That is a huge percentage there in terms of how infectious disease can spread, particularly this one. Brian Yanis, thank you very much. I want to bring in now Dr. Amish Aldalja, senior scholar at Johns Hopkins University Center for Health Security, and you are also an infectious disease expert. Let's dive in. How do you treat the measles? Is it deadly in this form that we know about?
Measles doesn't have a specific treatment. You kind of support the patient. Sometimes it can be very severe. The infection in that supportive care might occur in an ICU. There's actually been a couple of cases admitted to the intensive care unit during this outbreak. And it is something that is not always benign. You might hear of cases that are mild, but some cases will, like I said, end up in an intensive care unit, end up having pneumonia, end up in the hospital. So it's not something that should be taken lightly, and it's not some fancy disease that you think about only, your grandmother talking about it being some kind of rite of childhood. It's not something that we want to play around with.
Dr. Aldalja, and I tried to put it as delicately as possible, is this a deadly disease? Because with the infection rate of 90%, that means that anybody pretty much who's exposed who hasn't been vaccinated is going to get this.
Measles does kill thousands of children every year in other parts of the world. We haven't had a measles death in the United States for several years. I don't suspect we will see many deaths, but the fact that we're seeing intensive care unit admissions does speak to how deadly this disease can be. It's about a 1 in 1,000 death rate. Hopefully the cases in the United States will not go to that level, but it is something that we have to prepare for.
Should vaccinations be mandatory for this?
It's important to kind of draw a distinction. What we're talking about are school entry requirements, and those are mandatory vaccines if you want to enter school. What happened in New York was because certain zip codes had such high levels of infection that a mandatory vaccination order, which is a pretty rare thing, was issued because it really is a public health emergency. Because if kids are getting sent to the intensive care unit, I don't think parents have the right to put their children in harm's way like this. This isn't the common cold. This isn't even influenza. This is a much more serious infectious disease that really necessitated the New York City Department of Health to making that order.
Yeah, I mean, with influenza, we know that children and the elderly are put into categories that, because of their immune systems, if they are exposed to influenza, it is dangerous for them. But this is not in that category. I mean, you don't have to have a damaged immune system to get the measles if you've not been vaccinated, as I understand it. But I want to hit this with you because this comes into play now, the constitutionality of any sort of mandatory order. What do you say to those anti-vax communities who say, well, wait a minute, this is America?
Well, in America, you don't have a right to injure your children, and you don't have a right to neglect your child. And there have been cases where mandatory vaccination can be used in the setting of an outbreak where a public health emergency has been declared with a serious infectious disease. You have to remember that these children don't have the ability to say, I want or I don't want to be vaccinated. And you don't have the right to go expose other people. This is such a contagious disease. You can't go out into the community and spread it to somebody. People have a right to be free from infectious diseases, and that's part of the police power of the public health authority, that you can mandate vaccination when you're putting other people at risk. If you could go put all of these people away, they're not interacting with anybody else, maybe that would be an alternative, but you really are not unable to do this in this setting, and hopefully people will get the message and get vaccinated and put this outbreak to an end.
Well, we saw that tried in Rockland County. I had the executive of the county here, Ed Day, on set with me, but that was pushed back on. We'll see what happens here in New York as the cases increase. Dr. Odalja, thank you very much for your expertise and your time.
Thanks for having me.
In the battle for border security, a new construction company says it has the technology to